So good afternoon, everyone, and welcome to session 2 of CAHA's Greening the Healthcare Sector Forum. We're so glad to have you joining us today, and I hope you were present for this morning's wonderful session. My name's Cooke, and I'm a long-term friend of CAHA and a researcher at Griffith University, where I'm researching health professional leadership for transformation to climate-resilient, sustainable health systems. So I'm absolutely delighted to be facilitating this session this afternoon on changing hearts and minds at every level. I'm joining you from Jagera and Turrbal country in Meanjin in Queensland in Brisbane, and I pay my respects to the traditional custodians of the land and of the traditional lands from which we're all attending the forum. I celebrate their deep care for country and their knowledge and understanding of the relationships between country, kin, both human and non-human, health and well-being, which has been nurtured and passed on for thousands of years, and which can teach us so much about the nature and practice of health and well-being beyond Western medicine. A special shout out to Bupa Australia, platinum sponsor of this year's Greening the Healthcare Sector Forum. Their support enables us to bring this virtual event to life. And before we start, just a few housekeeping notes. At the bottom of your screen, if you have a look, you'll see the discussion forum button. Please do use that to share your thoughts throughout the session with the other attendees. Also note the Q&A button. So please write your questions there throughout the session, and we'll come back to them after the presentations. And a reminder that this session is being recorded and will be available via the platform for 4 months after the event. We'd also love to hear your reflections on today's sessions, and we encourage you to tag us at the addresses on the screen there at healthy_climate on Twitter, or the Climate and Health Alliance on LinkedIn, and hashtag Green Health Forum 24. So over the next couple of hours, we'll hear some great examples of what I think is actually the most critical aspect of this work, how key stakeholders can be enthusiastically engaged for sustainable and climate resilient healthcare. And I can't wait, so it gives me great pleasure to introduce our first speaker, Maja van Bruggen. As Director of Northern Territory Department of Health, Maja has worked to introduce sustainability across the whole of health by embedding sustainable practices in operational business. A key enabler is to build capacity and capability in local health services. Maja's presentation is Embodied Sustainability, Integrating Sustainability into the DNA of Health Services. Welcome, Maja. Over to you.
Thank you very much, Sue, and thanks everyone for their time. So my name is Maja van Bruggen, and I'm the Director of Sustainability Action, as Sue said. Just confirming that you can see the slides.
Not correct yet. Just 1 minute. There. Yep.
Okay, so we're all aware of the problems that we face, and we'll try again. We're all aware of the problems. So today I want to focus on what we can do in terms of changing hearts and minds at every level and making sustainability part of our health service DNA. So over the past 2 years, I've been working to integrate sustainability into NT Health, and 3 things were evident from the beginning. So the first was that people at all different levels and in different parts of the organisation want to make a difference, but often have competing priorities, no funding, and are not always clear on what will make the biggest difference, where to start, or how to navigate organisational change to get things done. I've also observed and experienced the challenges of trying to create permanent systemic change in a constantly changing environment. So the second thing was that there were no whole of organisation pathways for sustainability actions to be raised, prioritised, coordinated or progressed. And the third thing was that as a result of the first two, individuals were doing whatever they could with whatever they had to make a difference, but that the org wasn't yet equipped to tackle the really important, messy, but high impact priorities across the system. Just at this point, I'd like to recognise the vision and leadership of Dr. Mark D'Souza, who'll be speaking later in this forum, because it was his determined advocacy over several years which led to the creation and sufficiently senior and central positioning the role that I'm in today. So when I started in this role, the first things I did were connect with key people and map what was already underway across the organisation in terms of sustainability efforts and governance. So NT Health has 6 public hospitals, 76 health clinics and over 7,500 staff spread over 1.3 million square kilometres. And it became clear during this mapping process that efforts that were underway fit into 3 broad categories. It also became clear that they needed to be supported by broader system and contextual enablers, which needed to be influenced to achieve the more transformative and higher impact objectives. So in a nutshell, grassroots describes local site-specific initiatives generally driven by a passionate individual who usually does this over and above their actual job. Operational sustainability efforts describe activities which are part of a role or function, such as tendering, stores management, food service, transport, and so on. And these could be site-specific or territory-wide. And the strategic level, that's where the major policy change, organisational prioritisation and budget decisions occur. And that's where there are opportunities for organisation-wide decisions such as targets and policy settings. And this is where there's the best potential for large-scale, high-value impacts. And you can see the orange sphere, the system and context. That's where the whole government decisions, priorities and settings needed to be influenced. So things like whole of government emissions reduction targets, procurement policies, infrastructure frameworks, default options in the cross-government shared services panel contracts, etc., could either support or undermine our sustainability transformation efforts in NT Health. So once I'd framed the efforts across these dimensions, the next step was to work out what was needed to try and support the upscaling of grassroots efforts to operational business as usual, or the expanding of site-specific operational sustainability efforts to become embedded into the strategic organisation-wide policies and practices. And just an example there, it's still a work in progress, but things like the nitrous oxide reduction or the removal of desflurane from the formulary that need to be territory-wide. And the third one is elevating which strategies require a whole of government approach and then tackling them at across government forums like our Senior Officers Group for Climate Change. So how do we do that? Before I go on, I'm pleased to say that at that point in the journey, my submission to set up some new positions was approved, and I created and recruited 2 new positions, a sustainability performance analyst and an education and engagement lead, who joined the team at the beginning of this year. So a shout out to Lynn Smart and Jade Tavan. Thank you for the work that you do. So please note that we're still in the thick of this, and we're sharing what we've learned so far in the hope that it helps you on your journey too. So let's get into it. There are a number of ways that we will, have been working to integrate sustainability, including decision triggers, behavioural insights, facilitated collaboration, co-design, education, toolkits, but it all starts with language. So without further ado, words matter. So this is about speaking the same language by meeting people where they're at, as well as expanding their climate literacy as part of building an army across the workforce. So the first approach is about framing sustainability in terms which are already familiar. In this context, we found that all decisions about health system waste and emissions came back to the design of 2 core elements: the patient pathway or the supply chain, or how we make people well and what we need to do this. So by starting here, we could frame most problems like workforce shortages, budget savings, in ways which showed where there were opportunities to address these problems and achieve emissions or waste reductions. So this is where you'll identify and emphasise co-benefits. So In the context of quality improvement, this might involve partnering with the QI staff in your health service to embed sustainability concepts across all applicable QI initiatives and build their understanding of SUS-QI principles and success factors. In the context of clinical redesign, this might involve promoting, co-designing or supporting value-based healthcare approaches, which Kate Charlesworth mentioned earlier in the forum, as a means of achieving sustainability outcomes. In the context of accreditation, this might involve preparing to meet the environmental sustainability and climate resilience healthcare module requirements. In the context of risk management, this might involve preparing to meet climate-related financial disclosures. And in the context of financial sustainability, this might involve highlighting savings through initiatives such as reducing low-value care through the Choosing Wisely framework or reducing inappropriate glove use through targeted emissions. The main point is using the language of the people that you're working with, because they're not necessarily familiar with the sustainability terminology. In parallel to that, the second approach is building their knowledge of sustainability terminology. So things like resource circularity, waste hierarchy, emissions scopes in the health sector, etc., to equip staff to see where they can have the greatest impact. So this education can be standalone, for example, a lunch and learn session, or context specific, so part of a project or a tender design process or input into new transport models. We also use the consultations for both the anti-health sustainability and climate adaptation strategy to 2030 and the accompanying 3-year sustainability roadmap to build climate literacy around these terms, because you can't change what you can't name. So there's a third approach which relates to behavioural insights and framing, but we'll save that for another day. So now that you're translating sustainability concepts across disciplines, it's time for some transdisciplinary collaboration. And it's important here to remember that organisations are just constructs created by people to get things done, to achieve a purpose. So that's where you have a choice. Do you compete for resources, or can you reframe your approach and connect to collaborate across organisational boundaries? And most of you here on the call today are probably perfectly equipped and do that already. And this is where wherever there are co-benefits, there are opportunities to align and coordinate effort. It's not always the case, but it's worth looking. And I also agree with Auntie Desina, who spoke earlier about the importance of relationships. We've been working to build relationships across sites and organisational boundaries to support this transdisciplinary collaboration. So there's a lot of talk about governance in organisations and in achieving sustainability changes. So governance is really just a way of describing how decisions are made. And in the absence of a dedicated sustainability governance pathway here in NT Health, we've had to get a bit creative about influencing decisions at the earliest possible time. To do that, we've identified key decision points and we promote them as triggers for staff to get in touch with us. This is just an interim strategy as we work towards embedding sustainability into processes and templates so that it's a consideration during those things that are in those bubbles on the left, noting that they occur at both operational and strategic levels. So, how are decisions made? Well, on paper, they tend to look like this. We've all heard about costs versus benefits. In reality, however, they look more like this. So this highlights the realities of decision fatigue, and all of us, especially patient-facing staff, have enough to think about without adding more to the mix with sustainability-related change options. So setting the default option to achieve emissions and waste reduction objectives, for example, means the change can occur without burdening an already stretched workforce. So examples include flipping the default to oral rather than intravenous administration of medication, or virtual rather than face-to-face consults for appropriate clinics, or plant-based catering options and then offer meat as a special dietary requirement. There are many opportunities for default resetting. The one I'm highlighting now is the power of defaults in relation to organ donation. So consider the health system resources which the countries on the left consume, convincing people to opt in, versus the health system resources the countries on the right have available to use for other purposes because their default is opt out. Another couple of quick examples of where behavioural science can boost sustainability. So behavioural science tells us that people experience loss more intensely than the joy of the equivalent gain. So in this context, the New South Wales Behavioural Insights Unit partnered with the Central Coast Local District to reduce missed outpatient appointments. And that resulted in a 34% reduction in the number of people missing their appointments. So while that's not necessarily a direct sustainability goal, it does have health system waste implications, and that concept can be applied to more directly to sustainability initiatives. Another example, my favourite, is, in a nutshell, this shows the impact of a number of different interventions tested by the Behavioural Economics team of Australia in relation to reducing prescription rates of antibiotics by doctors in a targeted high prescribing area. If you're interested, Google nudge versus superbugs, and this has a huge potential in terms of reducing low value care. Right, I've already touched briefly on quality improvement. Here I just wanted to highlight that we are promoting the tools and mechanisms of the PDSA cycles, so the Plan, Do, Study, Act quality improvement cycles, to design better at the local level. So we've been working closely with our QI and clinical excellence teams across the territory to align our language as well as our pathway for sustainability action. We've also included building innovation capability as part of our strategy and roadmap, because an innovation mindset, skill set and tool set across the workforce lays the foundation for more transformational system-wide change. So this is still at the foundation laying stage, but we have made a start. So speaking of making a start, we've spent much of this year breaking down the levels of goals into more manageable steps. So you don't need to be able to read all of this, you'll see it in the recording, but at the strategic level, we started with the 10 focus areas of the GHH agenda, and then we added 4 more, which span all parts of the health system. And then we framed the strategic focus of efforts at an organisational wide level. Then what we did was we teased out at the operation to come up with the sustainability roadmap. And so that document is aligned, designed to help staff align, prioritise and coordinate efforts across functional and organisational areas over the next 3 years as a guide to investment in NT Health sustainability priorities. We went through a very extensive consultation process, which absolutely included open consultation, follow-up surveys, targeted committee meetings, clinical governance, clinical quality and safety, strategic infrastructure, and also one-on-one executive consultations to validate appropriate accountability and deliverables. On the home stretch, embedding a mindset is about people and our lens on the world. So in support of the workforce area of the roadmap, we're working to equip and activate our workforce so that staff have a personal pathway they can develop along, which aligns with initiatives in the roadmap and goals in the strategy. So this is being developed in parallel with our efforts around government. And we also recognise that there'll be times where people need to step back for various reasons. This is not a linear or one-way journey, but a framework to help us intentionally support staff to have a personal pathway, no matter their context. So I've covered off on most of those. I just want to touch on one last thing. In terms of performance, I haven't spoken about the outstanding work of our performance analyst in joining the dots between sustainability actions and the reporting framework she's developing. But I did want to mention the importance of meaningful and integrated metrics. And hopefully Lynn can showcase that in practice next year. So every organisation and individual within it is unique. So the real goal in identifying how you can use your skills, strength and relationships to integrate sustainability into your particular context. I hope there are at least 1 or 2 key takeaways which help you in your journey. And if you have any questions, I'm planning to explore the networking space in the forum platform. So hopefully we land in the same space and I can answer some questions there. Alternatively, feel free to email me. Thank you very much. And for those of you that take screenshots, here is a little reading list of things that I think are powerful supporters of integrating. Thank you very much.
Thank you very much, Maja. That was truly encompassing. I think you said it yourself, everything all at once and all at the same time. And I think also you really nailed it when you said relationships matter, people matter, and language matters. So thank you for that. I might move on to our next speaker now, who is Dr. Sonia Chanchlani. Sonia balances a strategic role with the National Health, Sustainability and Climate Unit alongside her academic roles in leadership and sustainable healthcare at the University of Melbourne. Sonia's determined to drive systems change across the health sector to achieve social and environmental justice while empowering clinicians and communities. Sonia's presentation is Transforming Environmental Sustainability in Hospitals, a toolkit to facilitate change. Thank you, Sonia.
Thanks, Sue. And I'm just confirming that you can see my slides and hear me. Yeah, perfect. Okay, so good afternoon. I'm Sonia Chanchlani. As Sue mentioned, over the past few years, I've held different leadership roles in Doctors for the Environment Australia and with the National Health, Sustainability and Climate Unit. But today I'm here in my capacity with the University of Melbourne, excited to present the first phase of our implementation research in partnership with NT Health, focusing on transforming environmental sustainability in hospitals with a toolkit to facilitate change. Ooh. Okay, with 80% of healthcare's greenhouse gas emissions arising from clinical care delivery, whereby 45% of these emissions are from hospitals, this is a really important space for us to focus our efforts. National enablers, including the Health and Climate Strategy released alongside the Safety and Quality Commission's module, highlight the importance of good governance and coordination of sustainability across health organizations, exactly like what Maja presented earlier. But where do we start when we want to make change from the front line? This was the challenge that prompted Ben Dunne and I to start collating national and international recommendations and best practice guidelines to help frontline clinicians, sustainability managers, and hospital executives. Building on the resources that we developed with Doctors for the Environment Australia, the University of Melbourne Hospital Sustainability Toolkit aims to build organizational capacity to deliver environmental sustainability outcomes. So the toolkit, as you can see, is made up of 4 complementary components, providing a framework to increase staff engagement with healthcare sustainability and build an organization's capacity to promote, implement, and evaluate local sustainability interventions to achieve environmental and financial outcomes. The core components presented clockwise are a project tracker that's a pre-populated interactive dashboard containing sustainability intervention suggestions for your organization, progress measurement tools, and project reporting templates. Education materials to integrate healthcare sustainability into existing curricula for all clinical disciplines. Sustainable quality improvement training to provide healthcare staff with skills to drive improvement projects that deliver environmental and financial savings. And environmentally sustainability competition materials, staff engagement resources, and implementation support. So I'll go through them one by one. This is an example of the project tracker in its original form that can be filtered by site, committee, and is pre-populated with sustainability intervention suggestions for your organization to adapt and prioritize to your needs. It helps track and measure progress, and the free online version is available as an Excel spreadsheet that can be integrated into SharePoint as displayed here. The benefits of SharePoint integration with the Power BI app is that it can automatically generate reports as dashboards displaying the activity taking place in your different committees, different types of activity, as well as importantly, reporting against the Safety and Quality Sustainable Healthcare module requirements. Education materials were developed by Doctors for the Environment Australia, but can be used by all clinical disciplines to integrate climate health considerations and healthcare sustainability into existing curricula. Integration of these resources into the intern curriculum at the Royal Melbourne Hospital resulted in significant improvements in interns' understanding of the impact of climate change on health, the environmental impact of healthcare delivery, and the health benefits of climate change and action. These results are available in a poster that's also displayed at this conference, so I encourage you to check that one out. Sustainability and Quality Improvement, also known as SUSQI, has been developed by the Centre for Sustainable Healthcare in the UK and offers a contemporary project management framework and lens, focusing on measuring carbon, waste, financial savings, and social benefits, using the well-known PDSA cycle of setting a goal, studying the system, designing the improvement, and measuring the impact to achieve the triple bottom line. As part of the toolkit, SUSQI training is provided to healthcare staff to help them lead improvement projects that can deliver environmental and financial savings, as well as improving care. The final component includes environmental sustainability competition materials, staff engagement resources, and implementation support. Ben Dunne will be presenting our journey and the incredible outcomes of rolling out this competition across the Parkville precinct in Victoria over the past few years. In early 2023, we were approached by Maja in her capacity as the NT Health Director of Sustainability Action to implement the toolkit across the NT public health system. With the support of a University of Melbourne grant fund, we're working towards that goal, and I'm excited to present the progress of our first implementation phase. Our convergent mixed method research kicked off in 2023 with an organizational readiness for healthcare sustainability survey and pre-implementation interviews conducted with executives and green champions across 6 NT hospitals to identify barriers and enablers for implementation of this toolkit. Quantitative data was analyzed combining both inductive and deductive approaches to identify themes, and our great implementation researchers used the NAS framework for analysis. The results of the pre-implementation readiness survey undertaken by 316 NT Health staff confirmed that there was a hunger to make change, as they wanted to be involved in environmentally sustainable initiatives, but lacked education, skills, and organizational support. Analysis of the data led to the following enablers and strategies informing the implementation of the toolkit that's currently underway. Maja's NT team has been busy engaging key interprofessional stakeholders and ensuring strong governance processes are in place, enabled by training and education and staff engagement strategies, as they've been adapting the toolkit elements to the local context in a staged rollout while leveraging off the financial benefits and upcoming accreditation changes. After many Zoom meetings, Ben and I finally met Maja's incredible NT team face-to-face in March and delivered multiple stakeholder engagement sessions across the 3 of the largest hospitals, where we were met with overwhelming support to implement the toolkit. Over the following months, Maja's team managed to develop a territory-wide sustainability strategy and roadmap, which is about to launch later this month. The toolkit has been adapted to facilitate delivery of these. The project tracker has been adapted on SharePoint and is about to go live at Alice Springs Hospital. The Royal Darwin and Palmerston teams are updating their sustainability committee governance with a plan to go live with the project tracker in February. They're also working on integrating SUSQI into the top-end QI hub. Our team is planning to do our post-implementation analysis mid-next year with a plan for the sustainability competition to launch at the end of next year. It has been an incredible feat to get us here, full of intricacies that are practically impossible to showcase in 15 minutes. But suffice to say, we're working toward a learning health system, one that enables research to influence practice and practice to influence research. That's exactly what the NT team is creating. It's far too easy for organizations to roll out new initiatives too quickly without doing the requisite groundwork. A significant lesson that we've learned was the importance of taking a considered, staged, evolutionary approach based on priorities, capability, and expertise. There's already been great interest in the toolkit and the results of this study. We're working with Mercy Health to consider these lessons as we implement the toolkit across 2 sites, and Metro North and Queensland are very keen to emulate the implementation and rollout across their 6 hospitals. The Safety and Quality Commission have provided the project tracker to all health services participating in the pilot module, supported by a community of practice. This hospital sustainability toolkit serves as a strategic framework for hospitals aiming to improve environmental sustainability, foster staff engagement, and enhance their capacity to deliver sustainability outcomes. Our team at the University of Melbourne is providing grant-funded implementation support to these specific sites. However, the 4 individual components of this toolkit are available for free and open access through the links in this QR code for you to download and implement independent of us. Before I finish, I want to send a special shout out to the NT Health team, Maja, Lynn, Jade, and Mark, for your incredible dedication and hard work. We couldn't have done any of this without you, and we look forward to showcasing the updates over the next 6 to 12 months. Thank you.
Thank you, Sonia. Fantastic once again. And it's just wonderful to see these amazing systems tools, which are so grounded in research and health professionals' understanding of the problem and co-design involvement in developing the resources. Thanks so much. And everyone is doing so well, we're actually a little bit ahead of time, but we won't count any chickens before they're hatched. Just a reminder to everyone to not forget about the discussion forum down below, and also keep popping your questions into the Q&A button also at the bottom of your screen, because there are so many good things happening. You'll forget your question by the end if you don't do that. So our next presentation features 3 speakers. Jane Bolster is a midwife and a district nurse educator in the Research and Education Network, Western Sydney Local Health District. Jane's committed to co-designing innovative interprofessional education programs for healthcare professionals. Associate Professor Vyas is a practicing public health physician with an honorary appointment at Western Sydney Local Health District and Deputy Director of the Health Environments and Lives, or HEAL, Global Research Centre at the University of Canberra, Australia. We have a third speaker who may not have quite joined us yet, but Professor Sandra Turner is a radiation oncologist at Western Sydney Radiation Oncology Network and a clinical professor at the University of Sydney. She has a long commitment to and research interest in education of health professionals at all levels, including developing leadership capacity. She is clinical lead of professional development in the Western Sydney Local Health District and co-lead of the FLASH programs that we're about to hear about. I'll hand over now to Jane Bolster to introduce the session and get us started. Thank you.
I think I might hand over to Artie, actually.
Thanks very much, Jane, and colleagues. It's a delight to be here speaking with all of you. I'd like to acknowledge 2 things at the start. Firstly, the Darug people on whose lands we work in Western Sydney Local Health District. I'm actually at the moment on Wajak Noongar land in Perth, presenting at a different conference. So it's a delight to be here and respecting our elders past, present, emerging. The other group we should be acknowledging, though, and this will come through in our presentation, is the wonderful set of people that have led the way, in a sense, in England. So the Centre for Sustainable Healthcare, on whose methodology we've drawn upon for some of the work we're kicking off in Western Sydney. I'll quickly put this slide up, which hopefully you can see. Jane, would you mind singing out if you can see the flash logo?
Can't see the slides, Artie.
Oh.
Oh, now we can.
Yeah, I'm happy for any of the presenters to be on screen. I'll be speaking first, then Jane, and then Sandra as well. Now, folks, essentially our presentation for the next 10, 15 minutes is we came upon a collaboration quite organically. So I'll just take us to the title of our presentation, which is FLASH, Fostering Leadership Across Systems in Health. This is something that Jane and Sandra had already developed as a local health district-wide program for interprofessional learning and leadership development. My colleague, Catherine Bateman, who's the Director of Public Health for the district, and I came from a different lens, which was talking about sustainable quality improvement, which is a tool that other colleagues have already mentioned on this conference, which is great to see. But the idea was, how do we bring those 2 things together interprofessional approaches, and environmental sustainability as part of leadership development. So that's where we came together as a collaboration. Very briefly, this presentation will cover what the problem is, and I've mentioned that already, bringing those disparate areas together, what the program of work is, and my colleague Jane will speak to that, and some of the methods and the results, which colleague Sandra will talk to. Essentially, we delivered a sustainable quality improvement workshop within the context of this FLASH program, and then we applied a validated questionnaire, which has been done elsewhere. So we had some good data, and we're ready to present that with you. And then at the end of this session, we'll give you some concluding reflections from this process and where we might head next. Very briefly, the problem is this. Health professionals of all types are leaders in effect, whether they wish to be or not. I mean, in clinical situations, we do CPR, we do resuscitation, and that brings us to this point of leadership is thrust upon us in many ways. This is all the more relevant when the climate crisis will be increasingly impacting our very ability to deliver healthcare at the same standards we do today. So this is in many ways an existential problem, which people on this conference certainly are aware of, and many other colleagues are waking up to. So the question was, how do we address the environmental impacts of healthcare while developing interprofessional leadership capability? And the answer, I think I've already mentioned, is we came together as 4 people who care about this problem. I'll hand over now to Jane Bolster, who will tell us a bit more about the program and where that's, how that developed and where that's taken us. Over to you, Jane.
Okay, thank you, Adi. So FLASH is an existing leadership development program that it's based at Western Sydney Local Health District, and we also collaborate with the Sydney Children's Hospital Network. We have 3 streams, professional streams: medical, allied health, and nursing and midwifery, which are run concurrently using full day monthly workshops. And our cohort are in for the medical program consultants in their first 10 years of independent practice, advanced trainees and fellows. The allied health group are levels 3 and 4, and the nursing midwifery group are nursing and midwifery, clinical nurse and clinical midwifery consultants and nurse practitioners with an occasional nurse or midwifery educator. When we run this program across a 7-month period, we have the 3 individual streams run concurrently. At 3 times, we bring them together for interprofessional workshops. We have approximately 120 people engaged in these interprofessional workshops. Next slide, Adi, please. We use the Australian Health Leads framework to provide the themes and to ensure that we cover all the content that has been supported in the literature as being articulating to leadership development, and especially for established, experienced clinicians. So each of the domains are covered, and if you go into the next slide, Adi, you can see that we broke down each of the domains into some subject matter headings there, of which we're very proud of our self-care and coaching foundational experiences for the participants, and also the opportunity to shadow a leader. We found that in this program, we really did have space for sustainability. That is obviously missing, but it was something that is evolved over time. And when we met Adi and Catherine, we thought we'd take the opportunity to engage in sustainability and climate. And this is a very good thing for healthcare. So if you could go to the next slide, Adi. We have actively engaged in many areas within our program. So you can see that we have the self-care toolkit. We've done a lot on change management, growth mindset. We use a communication tool called Insights Discovery, and we've engaged the consumers and Aboriginal perspective in as many parts of the program as we could. So in that regard, it seemed absolutely fitting that we also integrate climate and in healthcare. And so we attempted to use the SUSQI in the nursing and midwifery workshop, which we're about to talk to you about. But we've also covered adaptation, climate adaptation as well in some of our other programs. And we are going to look at how we're going to incorporate that into our program next year on a larger scale. Next slide, Adi, and last one. So here's a photo of one of our interprofessional workshops. We deliberately place them in allocated seating with mixed professions. Their name badges only have their name and their communication preference. No professions are stated. And our program is very much a hands-on interactive program. So we really think that this environment is potentially the best way of getting climate action and healthcare out to the clinicians who have the opportunity to utilise this work in their healthcare setting. Finished.
Thanks very much, Jane. A couple of slides of interlude from me, and then I'll pass it on to Sandra. This slide just shows you that this methodology, sustainable quality improvement, is well validated. There's a lot of NHS trusts or hospital groups in England and the UK broadly that are applying this method. And there's a lot of literature that's been published around it, surveying the people who use the tool, all the way from the undergraduate medical level, but also in other professions, nursing, midwifery, allied health, and through to practitioners as well. So across the whole scope of what people do in the health service. To give you a snapshot of what SUS-QI actually ends up doing, very, very briefly, let's take a couple of examples here, cannulation or inhalers. And many of us are aware of the impact that different types of inhalers have in terms of CO2 greenhouse gas emissions. So SUS-QI looks at the triple bottom line, as you can see, represented by the heart, the dollar or the coin, and the green tree. And the idea is that you can actually improve patient care while reducing costs and producing environmental benefits. And then you see a little person at the bottom, which is, person-centered, right? Care that we aspire to deliver in health, but also we put the staff element into it as well. So things that are good for the patient, but also good for staff. I won't labor on this slide, but very happy to talk about this in the Q&A section. But it's time to hand now over to Sandra, who will speak to the pilot evaluation that we did using some of the studies or the methodologies that I presented just 2 slides ago. Thanks, Sandra.
Thanks, Adi and Jane. So really, I'm just adding to this conversation by presenting some of the results of our first SUS-QI workshop that we ran within the Flash program. And it happened to be that the session where we could start incorporating climate and health was for middle and sort of mid to more advanced leaders in nursing and midwifery. We had 28 of those in the cohort as part of our interprofessional group, and we used the validated SUS-QI self-reported survey, which Adi showed some of the literature around, specifically the same tool used by Cleary and colleagues for medical students at Bristol University in the UK. So we delivered this pre and post workshop online through a QR code and made sure that people did it on the spot. We allocated time within the workshop to make sure we collected pretty complete data. And this, we won't show you the whole instrument here, but this survey asked questions specifically around QI, some global views on sustainability in healthcare, and about SUS-QI in particular, using Likert scales, self-recorded Likert scales, on scales 1 to 5. And the domains of the instrument deal with the people's knowledge, confidence in and attitudes with regard to education and application in the workplace for these particular topics. So the next slide is just a summary of pre, shown in blue, and post workshop responses. This survey, this section of the survey, particularly dealing with knowledge of and confidence in the use of QI in general, but also confidence in understanding climate change and sustainability concepts. And I won't go through all the details here, but you can see that on all of those items around knowledge of QI and impacts of climate change and sustainability QI, responses after the workshop had increased over people's understanding and awareness beforehand. So that was a pleasing test to us that we were on the right track. And particularly if the next slide, you can see the items that related to knowledge about climate change and sustainability in healthcare and performing sustainability quality improvement projects were the greatest improvement in people's understanding. So people did have some sense of QI, but the climate change piece, they certainly had more ability to improve in. Next slide. The second part of the survey looked particularly at the people's views of the importance of education in the areas of quality improvement and sustainability, and very importantly, their likelihood of taking action in their own workplace. And next slide, please. Really the highlight here is that although people had quite firm beliefs of the importance of education around these topics, what really most changed was people's ability to, or sense of their ability to be able to implement a sustainable quality improvement project in their workplace in the short-term future. So that was the baseline to us thinking, okay, we want to roll this out further. We want to do more within our Flash program. We want to make it into professional, and we're working towards a more robust project with larger numbers around these topics next year.
Thanks very much, Sandra. Noting that we're 13 minutes into our 15 or less minute presentation, we might end with a couple of concluding reflections. I'll hand over to Sandra, I think, at this point, or Jane, perhaps, to give us their thoughts.
Well, I think that what I've noticed when we were doing this program is that I've never noticed so many people, I've never seen so many people so willing to put their hand up to do something and to get involved. Usually we're having to twist people's arms to do something more on top of their already very heavy workload. But the enthusiasm for being involved in climate action within the healthcare setting has been really commendable. So we're buoyed on by the great level of positivity. Aditya?
Thanks very much, Jane. My reflection is that I think it's sort of on this slide that, in fact, there are system priorities that are now including environmental sustainability that inevitably have to address climate change adaptation. So both sides of that coin, mitigation and adaptation. And the beautiful part of what I saw when I arrived at Western Sydney Local Health District was the LHD is already investing in this approach, but from another angle, which is interprofessional and leadership development of staff. And that's a rare thing in a health service to, dare I say, invest back in its staff development. You can take that comment in a few different ways, but what I really mean is that it was great to see that the substrate for action was already there. That was the point that Sandra was making on her last slide with our findings. And really, it's been a delight that we can start experimenting around this nexus of how do you change hearts and minds at every level, bring them together in a room. We do interprofessional learning. We talk about environmental sustainability, and we use that fundamental concept of quality improvement, which improves patient well-being, staff love it, and then we can address the environmental impacts of the health service as well as the financial bottom line. So there we are. I might hand back now, and thank you very much, my co-presenters, Jane and Sandra, for coming along today. And thanks everyone for listening in.
And thank you, Adi, Jane, and, oh, sorry, I've just lost your name. Sandra, sorry. That was really also very inspiring, because I think we've all known for a long time that health professionals really want to do this, and you've now been able to get them all together, working together to develop their own capabilities to do that. So another fantastic example for us to be inspired by. And as you say, Adi, we're all actually doing very well on time, but we'll keep moving ahead so that we can get to the question and answer session and have plenty of time there. Our final speaker for the session is Ben Dunne, thoracic surgeon who is the Royal Melbourne Hospital's clinical sustainability lead. He chairs the University of Melbourne Environmentally Sustainable Surgery Network, co-convenes Doctors for the Environment Australia Sustainable Healthcare, and is a member of the Royal Australasian College of Surgeons Environmental Sustainability and Surgical Practice Working Party. Another tongue twister. Ben is passionate about driving clinician engagement with sustainable healthcare initiatives, reducing low-value care, and improving collaboration in sustainability across the health system. His talk is about environmental, financial, and co-benefits of a hospital environmental sustainability competition. Over to you, Ben.
Thanks very much, everybody, and thanks for the introduction, Sue. You can see the title of my talk as you introduced, but as you can see all the different names below the title, it's certainly far more than me that was involved in all this. This was certainly a fantastic collaborative effort. It started off at Royal Melbourne Hospital and the University of Melbourne, but kind of has spread to the Peter MacCallum Cancer Centre, the Royal Women's Hospital, and as well to WEHI, our next door research institute, recently as well. So it's been great to see this grow. But let me get started. We've touched on this before. We know that 80% of clinical care, 80% of healthcare related emissions are from clinical care, and that a large proportion, about 40% of those, are either harmful or wasteful, or could be considered low value care. So it's a great opportunity for us to target those things and produce better care for our patients and better care for our planet. And really starting with the hospital system is key because, as again came up in one of Sonia's slides earlier on, 45% of our emissions seem to come from the hospital sector. So it's a great place to start if we want to have some impact. In 2022, Monica Page, who's our sustainability manager at Royal Melbourne, along with myself, we were really looking to reinvigorate the Green Champion network we had at Royal Melbourne Hospital that had, like many things, had taken a bit of a hit in terms of engagement due to COVID. I really wanted to make sure that we were across all the environmental sustainability projects that were happening at Royal Melbourne at the time. We decided that a sustainability competition would be a great opportunity to scope some of the current and recent projects that had been underway, inspire staff to start some new initiatives, and celebrate great work that was being done around the place. So we launched our competition. It was open to all clinical and non-clinical staff. We allowed submissions for projects that have been completed in the last 2 years. And we made sure we provided support from our in-house QI team, as well as worked with the University of Melbourne Sustainable Healthcare team to customize some project support resources. And Monica and myself helped out with carbon and environmental impact calculations as well for anybody who wanted to undertake a project. So these were, as have been touched on a few times now, the sustainable quality improvement sort of framework was the additional resourcing and additional lens that we added to our existing Royal Melbourne QI project plans and templates to really make sure that our participants added the sustainability lens to the work that they were doing and the projects they were entering in our competition. And really, we were blown away by the number and the quality of the projects that have been conducted by our staff, and the overall environmental and financial savings associated with these projects. The total financial savings from those projects submitted came to $500,000, 2.5 million kilos of carbon dioxide, and 250,000 items that have been kept out of landfill. So it was really amazing and really blew us away, showing that we could deliver across that triple bottom line with an initiative like this. There was a real range of projects as well, from sort of clinical change projects based on the Choosing Wisely guidelines, particularly successful in the emergency department, reducing blood gas and coag testing there, as well as in our own cardiothoracic surgical pre-admission clinic, reducing unnecessary testing there. But there were also great entries, around telehealth projects and reducing mask wearings for those, as well as saving paper in some other non-clinical areas. It was so successful that in 2023, we were able to expand the competition. The Peter MacCallum Cancer Centre and the Royal Women's Hospital were really keen to get on board. And we improved the access to the sustainability and quality improvement resources, the SUSQI stuff, with increased support from the University of Melbourne team and Sonia Chanchlani in particular. In that year, 2023, even though people only had kind of 6 to 9 months to get their projects up and running and submitted. We actually had 17 projects submitted from across the 3 sites, resulting in savings of $160,000, 140,000 kilos of carbon, and about 3 tons of waste diverted from landfill, which was really amazing. And on top of that, we went back and had a look at the projects that had been conducted in the year before, found that the savings had been maintained and sustained. So we were up to, at the end of that year, cumulative savings of $800,000, with, of course, no adverse patient events being reported through any of this work, because it's all about improving quality of care as well. So again, some more examples from the 2023 competition, really demonstrating that the Choosing Wisely projects are fantastic drivers of great innovation and kind of environmental as well as financial savings, as well as things such as eliminating nitrous oxide use from the Peter MacCallum theatres. As we know, nitrous oxide has a particularly high global warming potential, as well as more Choosing Wisely projects in our pre-admission clinic and paper-saving initiatives from our wards, providing information to patients via QR codes rather than paper where that works best for them. But there were also some food waste reduction projects run by our food services and dietetics department, some great research projects, reducing the waste around research in dermatology, again, more telehealth projects, and great to see some other initiatives about reducing single-use products as well. We ended up moving over from single-use drug trays to reusable drug trays in the Peter MacCallum theatres. So it's really an honor to be part of this collective effort and be able to help our staff across the 3 organizations really gain recognition, be celebrated for their work reducing the environmental impact of the really high quality care that we deliver, and that remains the focus of everything that we do. But we undertook some more formal feedback and evaluation at the end of the 2023 competition. All the participants that got back to us found that sustainability and quality improvement resources clear. They found them helpful, but they did request some more didactic teaching on how to lead a sustainability and quality improvement project. Those who use our SUSQI resources to plan their project, we found generally submitted higher quality entries, so really doubling down on the importance of that framework being used. But probably most excitingly, all of our participants responded saying that they were all motivated to continue working in sustainable healthcare and would enter the competition again. So this proved to us that our competitions are an effective way to increase workforce engagement with sustainable healthcare initiatives, and that can result in significant environmental and financial savings, which does help get you the attention of your healthcare leadership team, particularly in the current climate. But really providing clear supporting resources and SUSQI improvement education is really key to these successful projects and fostering a culture of sustainability within your organization. So we've continued to evolve into how we design, deliver, and support the competition. And this year we moved all the competition supports a bit more centrally to the University of Melbourne, as we expanded our competition to include the Walter and Eliza Hall Research Institute next door to the Parkville Clinical Precinct. And we plan to expand further in future years. Our University of Melbourne Sustainable Healthcare team, Sonia Chanchlani led the recognition of our team as a SUSQI beacon site by the Centre for Sustainable Healthcare in the UK. And we've put together our first formal SUSQI workshop, which we were really pleased to be able to deliver just a few weeks ago, deliver that face-to-face at the University of Melbourne. We've covered a little bit on this before, but this is really just an outline of what that SUSQI framework is, setting goals, studying the system, designing the improvement, and measuring your impact. And I'd like to really congratulate all the attendees of our first workshop that showed up and made it such a success, and pass on my thanks to all the facilitators. I know some of them are online today and listening, but it was an enormously successful event. So much so that a couple of months ago, we were really pleased to find out that we've been nominated as a finalist for the Victorian Public Healthcare Award for the competition, for helping to create a sustainable and climate resilient health system. The awards are on Tuesday night of next week. So we're actually competing against Peter MacCallum Cancer Centre and one of their initiatives, which we've been involved with as well. So it's great to see stuff like this cropping up all around the state, but it's great to be nominated and have some recognition for the work that we've been doing. So some lessons that we've learned Environmental sustainability competitions can serve as an excellent engagement initiative. They can generate meaningful environmental and financial savings. And staff are really keen to get involved in this work, particularly when you provide some support and some training and help empower them to get involved and do more. For anyone interested in learning more, you can have a look at this QR code that takes you to the webpage for our 2024 competition. You can see some of the resources we've created for our competition as part of the hospital. And as you know, this is all part of the hospital sustainability toolkit that Sonia Chanchlani spoke about earlier in the session. And we're really looking forward to presenting the results of the 2024 competition in early 2025. I'd like to thank the organisers for kind of having me along and allowing me to present the results here today. Unfortunately, I won't be able to hang around for the Q&A or the networking opportunities because I have to actually go back to my day job now. But thanks very much for having me here.
Thank you, Ben. And once again, I'm sure everybody online is jealous that they haven't been part of all of these wonderful pilot training opportunities that people have been working on. But what also strikes me is how generous everyone is with the sharing, and what a wonderful forum it has been for sharing between states and between health systems, the learnings that each area is developing. And really, this has been a treasure trove of tools to help us make these systems changes and to engage people and to change hearts and minds at every level. So I'd just like to thank everybody, again, all our presenters for such wonderful presentations. And those of you who can stay, we're really delighted to make open the question and answer session. But just before we start, we're sharing a Mentimeter link in the chat and in the QR code, which will come on screen shortly. So please do take a moment to jot down your key takeaways from this session, excuse me, to share with others, and you'll be able to see other responses live in Mentimeter. Now, don't forget that there is a live Q&A box down below, so please pop some questions in there. I see that we have one from Rachel, and we'll move to that in a minute. But do take the opportunity to put your questions to people. I think we'll move to having everyone back on screen. Is that the case, Glenn? Wonderful. Okay, so I'll just come to the first question. Okay. So Rachel asks, the SUSQI tools for emission measurement are not tailored to the Australian environment. Did you adjust these to the NGA or do any other actions to support more localised emissions measurement for Australia?
Sue, could you just repeat that question? Sorry.
Sure. Rachel's wondering whether you adjusted the SUSQI measurement metrics for Australian circumstances and for local use. I think that's in the toolkit and in the tracker, the carbon tracker tool that you talked about, Sonia.
Adi, do you want to, is that for us, do you think?
I think so. I think it's probably for both of us, actually, for Sonia's
sorry,
presentation.
Sonia.
I'll tell you our approach, and thanks, Rachel, very much for the question. And I know you have a lot of expertise in carbon footprinting methods, for example. So, and quite separate to this, we're working on other projects on input-output modelling of the carbon footprint of healthcare, but actually now using those methods not only to do the national footprint of carbon for healthcare, nor for local health districts, actually drilling right down into the entire clinical service pathway. So that's sort of the cutting edge implementation of using those NGAs, National Greenhouse Accounts, However, for the purposes of what Jane and I and Sandra and Catherine put together in terms of an interprofessional leadership development program, the thrust is not so much, can we sit there for a number of hours and calculate every single CO2 equivalent molecule emitted by healthcare? That can come. We can do that, and that requires a bit more technical methods. The purpose was really to say, firstly, to socialize the issue, and secondly, to show that within existing quality improvement processes, we can use proxy indicators, right? So in that sense, to answer the question very specifically, no, we didn't make the measurement or the carbon footprint measurement part of the SUSQI tool adapted to the Australian setting. But again, that wasn't the purpose, and there are other ways we're pursuing that as well. Hope that answers the question.
Thanks. And it was for Sonia, who talked about the use of the NHS tools for emission measurement toolkit for the. So I'll hand over to you.
Yeah, our team actually did create an Australian-specific resource pack based on the UK resources. We promoted the baseline formula of calculating carbon emissions times activity, but we promote local Australian carbon data that we have vetted and consider high quality. And as Adi said, we promote the concept of various measurements, including waste alongside carbon and patient outcomes. So in circumstances where carbon footprinting is not available, we do encourage other opportunities to measure the impact.
Thanks for that answer, Sonia. And in fact, Rachel has. Rachel, would you like to put your mic off and speak to your comments there, if you'd like? Put your mic on, I mean. Oh, no mic control, sorry. So Rachel said, thank you very much. She's also been looking at emissions measurement in Australia, and it's a very good way to start a conversation with the use of those tools that have been developed and trialled so effectively elsewhere. Now, I'm a little surprised at this level of at the lack of questions in the questions Q&A box here, because I know that everybody is absolutely fascinated with what we've been talking about, what you've all been talking about. And I'm just making it clear that there is plenty space for some questions. And in fact, perhaps I know that most of the panel or the speakers of this session know each other and are familiar with each other's work. But do any of you have any questions?
I'm happy to jump in, Sue, but also I do note there is another question from the audience, which we might take first. Sure.
Shall we? Well, we'll move to that question and maybe come back to yours, Adi. I'm jumping between too many buttons here. Okay, so the program, Michelle asks, the program highlighted the need to educate and engage people at a local level. APRA currently is developing their sustainability statement, but throughout the undergraduate program, there's no guiding policy for educating undergraduates. And Michelle makes the point that educating all disciplines should be paramount to disseminating this information, and asks for your thoughts. Go ahead, Sonia.
The Australian Medical Council that sets the standards for medical education has actually been working hard over the past few years to update education standards to include planetary health and sustainable healthcare principles. And I'm really happy to say that as of this year, all medical schools and intern teachers across the country must update their curriculum to include concepts of planetary health and climate health risk. And a number of our advocacy groups, including Doctors for the Environment Australia, is working closely with the AMC to update the specialist medical education standards for ensuring that CPD, trainee, and medical fellow curriculum aligns along the new medical continuum. And we're encouraging other clinical disciplines to adopt new baseline standards that have been the first ones introduced in education across Australia, really adopt them earlier now into their clinical disciplines while their professional organizations catch up.
Terrific, thanks. We do have another couple of questions now. And one question that I have is that I know that working in universities, a lot of the educators in health feel that they are also not very well equipped to be teaching about these things. So they'll be very, very happy. I know that there are opportunities to share resources at a global level, but it's also wonderful to see how much is now being developed in Australia for sharing. Okay, so I'm now coming back to Rachel, who spoke before. She has a cheeky question. She says, did any staff bring up or ask about ethical use of financial resources? She says that she did a small analysis of how much money moves through public health systems and the flow-on impact of how financial institutions that continue to support fossil fuel investments may be able to inadvertently create harm. Have any staff or teams in competitions asked or talked about mandating changes to default super or financial institutions to only ethical ones? I think that's possibly directed at Ben more about the competitions, but other participants?
Yeah, I can also speak to that. So the toolkit has a number of different tabs relevant to different levels of clinicians and executives and organizations. So specifically the executive and board level recommendations for change specify resources and encourage diversity. However, there hasn't been a groundswell from any of the participants in our competitions to strengthen that consideration.
Okay, thank you. Thank you, Sonia. Wendy asks, can this toolkit, the SUS-QI tool, be applied in a non-hospital healthcare setting? So perhaps aged care?
Absolutely. The simple answer is very much so. It's slightly harder to do that in a non-clinical patient care setting, but absolutely we have experience of using this in a number of settings, right down to, say, adopting paper-light approaches for a health department in Western Australia, all the way through to reorganizing patient transport, or the way even patients arrive by themselves to the hospital campus. Things like this are amenable to this tool, because simply it's about quality improvement. You go through the plan, do, study, act cycle, but the special part here is then it's tailored towards some of those clinical settings or healthcare settings broadly.
Thanks. And now, just going back to, I'm not sure who mentioned it, but the Australian Commission for Quality and Safety in Healthcare, Sustainable Healthcare module, and the materials that are coming with that. Would anybody like to elaborate on that a little bit and talk about the relationship between that and the SUS-QI type of principles and approaches?
I wouldn't comment on the relationship between the two, but I can highlight that The Commission is undergoing a piloting project and pulling together a whole range of resources, of which the SUS-QI are obviously kind of world standard, and then looking at how that translates into practice, into implementation, and that's happening as we speak.
That's terrific.
Do I have time to add that those of you familiar with the safety and quality standards know that quality improvement is already embedded into every standard as a baseline for organizations to reflect on their outcomes and work towards improvement. So the new module that I mentioned that's being piloted by the Commission at the moment aligns with the general governance and quality improvement expectations, this time with an extra sustainability lens. So this isn't the last time you'll be hearing about SUS-QI.
Great, thanks. I think people are very interested to hear a lot more about it and to use it in their own work. In fact, some research that we did in Queensland with health services, hospital and health services through Griffith University, that was one of the conclusions, sort of independent of the Australian College Commission for Health Quality and Safety in Healthcare tool coming out. But one of the conclusions was that the sustainability projects just fitted so beautifully into the quality improvement type of approach, and where a whole lot of new staff coming into the hospital system, we're looking for projects to do, and their sustainability projects were a great opportunity to use that as a quality improvement approach. So yes, many great minds thinking alike there. Now, I can't see any more questions at the moment, and we do still have, we've got a full quarter of an hour.
So I wonder if it's worthwhile mentioning the work of the ANZ HPR, the Australian and New Zealand Health Procurement Roundtable, because I think, as a lot of the people online would be aware of, is that the Scope 3 emissions make up the bulk, 3/4 of the health sector emissions, and a lot of that can be tracked to upstream supplier and supply chain. So just for those that are not aware, the Australian and New Zealand Health Procurement Roundtable is working actively. It's made up of chief procurement officers from all the different jurisdictions, and they're working with the NHS, for example, but also internally to what can be done in the healthcare sector to tackle emissions. And there's a ESG working group, so Environment Social Governance Working Group, made up of people from across the jurisdictions, and we've got a work plan which highlights the actions that can be taken. What we're doing is we're creating a website which sets out, here are the goals, here are the principles, and creating a repository of tools so that procurement practitioners in the health sector can start upskilling and considering the environmental implications of the decisions that they make in that, not just the procurement space or the tendering space, but actually further up the chain in terms of setting a procurement ambition. So in a nutshell, the NHS set forth their ambition that all of their suppliers would be carbon neutral or have decarbonisation plans in place if they wanted to gain any work with the NHS. So that was one way that they were telegraphing the boards, get on board. So we're looking at how we can replicate that in Australia and what that looks like.
And that's wonderful. Thanks, Maja. It's very interesting to hear how these things are starting to happen at a national level and the collaboration and cooperation across the system. Jane, I'm wondering if you have any thoughts that you'd like to add, or any, because I'm particularly interested in the leadership aspects that you were bringing to the fore so clearly before. What is it? Tell us more about why leadership is important, can you?
Well, firstly, I should declare that I am an absolute newbie to the healthcare sustainability and climate section. However, we do have a really successful program that we developed over 4 years ago, and we've spent our time in this program teaching or reminding or letting all of our clinicians know that regardless of whether they have a formal leadership position, that they are all leaders. And they are because of their responsibility as health professionals. And so we have the climate crisis as it stands, and we have clearly compassionate, caring people who are engaged as health professionals, then it seems like a really good fit. So bringing in climate, we give them the skills. So we give them the knowledge of what it is, how it's relevant to them, how it's going to impact on their work, and then we just open their minds to what's out there. So we've tried, the SUSQI was quite a successful program because we took them through, we showed them how what some people have already done in sustainability and healthcare within the district in different departments. And then we said, here's the toolkit. This is what you do. Let's go and try it. And so we had all the groups trying it out. And people were just so amazed with what they could do just in their clinical setting without anything extra, just a bunch of people that were thinking along the lines that they were. And now they've got a framework and a requirement to actually commit to this. So it gives them some validity in terms of what their thoughts were, but just didn't know where to go with that. So I think the results were really heartwarming, quite frankly, in terms of the level of keenness to be engaged. And then in another workshop we did with the medical cohort, we introduced the climate adaptation, climate risk assessment thing, and we went through all the different elements of that. It was just really interesting to hear pretty much how people just hadn't really considered the impact of climate change on the way they did their work and patients that they saw, but yet then had an understanding that there was some mechanism to enable them to be part of it. And clinicians are a really good part, play a really big role, because the majority of the workforce in the local health districts, and in our local health district, we have about 13,000 staff, of which I think 9 or 10,000 are clinicians. And so they're a really good group of people to be able to get the message out and to make real change. So a leadership development program and an interprofessional leadership program is probably a really good way to do that, because then you get to see, I'm excited about what we'll achieve next year in terms of true interprofessional, because we've had nursing midwifery, which is in some sense interprofessional, and with the doctors, they're interdisciplinary. We have many, say 14 different disciplines in that group. And so we will then have in our interprofessional group with the allied health staff as well, we will end up with an opportunity to share the different perspectives as well to the one issue that they come up with. So I think that I'm really looking forward to that next year. Adi, did you have anything that you wanted to add?
Thanks, Jane. I definitely did, because I think you said, for me, the key thing from what you said is around essentially seeding clinical champions for this work. And my great frustration around, and I think maybe this is shared by other panelists here, but also the broader audience, is time is running out. We need to act fast. We need to convince other people to join us and to work together on this. The trouble is, at least in my experience, and I'd love to hear from Maja, for example, and of course Sonia as well, that many of us have worked in senior positions. I've worked in New South Wales Health, for example, the health department, or the national unit now at the National Department of Health in Canberra. We have these mechanisms, these structures. So the top-down piece is looking pretty good, if you ask me, compared to where it was, say, even 3 years ago. my great frustration is, how do we build this groundswell of activity bottom up? And Jane, that's why it's been such a pleasure really to have worked with you and Sandra over the last couple of months, because the bottom up groundswell is what we need. And your program, the Flash program, already embeds that clinical championship and leadership at all levels. And I think, to me, that's a big antidote to the frustration.
Comment that I would make there, Adi, is that I think, especially at the front-facing or patient-facing of the workforce, there is a huge degree of exhaustion following on from COVID, with workforce shortages that are projected to get worse nationally and internationally before they get better. So for me, that's the piece where we need to marry up the workforce shortages with the opportunities that de-implementing low-value care, for example, represents, or the capacity we can claw back through value-based healthcare approaches, where we're not leaning so heavily on the acute sector, where we're diverting patients towards services that may be of greater value to them and have a greater benefit to both the patient and the health system. So for me, that's the first step, by marrying up the needs of the people who are the groundswell. If we want them to be recognise the benefits, it's about solving their problems first. Because, if you think about Maslow's hierarchy of needs, they're kind of at the bottom under pressure. If we can solve some of those problems towards the bottom, then that, the next layers up, where they can start engaging in these next level quality improvement initiatives. That's where we then get our change at pace and at scale.
I think, Maja, when I think about some of the examples that were shared, say using some, Adi, what was it, the sheets, the yellow transfer sheets, where people hadn't considered these little tiny changes that they could make on the ward. And then that gained, so when you were talking about COVID and the burnout, that's so true. And so give them something that's really something that they can engage with and is positive, and they feel like they can make a change without, and it's basically sitting underneath them or right at their fingertips, then that is a really positive thing to be engaged with. And that's what we found the participants reflected in their conversations with us after the program.
That sounds really, really encouraging and inspiring. Now, does anyone else have a last comment to make before I wrap up with a few messages, a few more housekeeping tips?
But I do have a screen share which may or may not be possible, which possibly illustrates what Jane has mentioned and emphasises the point about, if we help people to solve the problems that they're facing, they may also have sustainability, planetary co-benefits, but it may also help to build that groundswell.
Yeah.
Thank you.
Thank you. Okay. Well, can I once again thank all our fabulous speakers today for generously sharing your stories and experiences. And that brings us nearly to the end of this session and today's program. I just do have a few final notes. As mentioned earlier in the morning, there is a button that reads Event Stream. This allows you to post an update, image, or respond to others. So please do feel free to post. And if you're holding a group viewing session, as Aditya mentioned this morning, we really would love to see your setup. Don't forget the Meeting Hub gives you the opportunity to connect with other attendees, and you can access that from the lobby and selecting the Air Touch. Now, please do stay on to mingle with other attendees and the presenters for the next 20 minutes or so, a bit more than 20. And just a reminder that next up in the program tomorrow, we have 2 great workshops. So one on health systems in a warming world, and the second one on Indigenous regenerative sustainability for climate and health. And we hope to see you there. Final message, in between the workshops tomorrow, please don't forget to check out Bupa's sponsor stall. Thank you once again to all our fantastic speakers, and we'll see you all in a minute, I think, in the networking session.